Hi, I'm Dr. Ruan Louw. I'm an electrophysiologist, and what that means is we specialize in treating various types of heart rhythm problems as well as heart failure with various types of pacemakers. We treat various types of heart rhythm abnormalities, and these abnormalities can originate from the top chambers known as the atria or from the bottom chambers known as the ventricles. And the main way in which we treat these arrhythmia is by creating tiny little burns in the heart with a procedure known as an ablation. In the treatment of atrial fibrillation, there's essentially been two ways of delivering lesions. First of all was the point-by-point ablation approach, and that was really beneficial in the sense that we are able to deliver tiny little lesions very precisely. Later on, one-shot devices came along, which had the benefit of creating much larger lesion sets, which allowed us to do a procedure perhaps a little bit faster, but the drawback was that the catheter is not very maneuverable and it does not allow tiny, precise lesion sets as we would with a point-by-point ablation approach. With a dual energy catheter, which is essentially a point-by-point platform, we've got a tiny little tip catheter that I can move around in the left atrium and decide where I want to deploy my lesions very precisely and effectively. With a one-shot device, it works really well, but we are a little bit limited in where we can create our lesion sets. This new dual energy platform combines the best of both worlds. It allows us the adaptability of a point-by-point small catheter, which is very maneuverable. We can decide exactly where we want to deploy our lesions, and we can tailor our therapy based on the specific patient's anatomy and rhythm problem. And this can be done without the drawbacks of radio frequency energy by using pulsed field energy. There are certain areas in the heart where we cannot deliver pulsed field energy, and specifically in areas near coronary arteries, the blood vessels that surround the heart. Unfortunately, pulsed field energy at this stage can create very dangerous spasm of blood vessels, and it's important to avoid these areas with pulsed field energy, and that's where the beauty of the radio frequency comes forward. We are able to deliver lesions in areas where the pulse field presently cannot. So to have the safety of pulse field in most areas in the heart is a massive bonus because it improves the safety of the procedure. But in certain areas where pulse field limits us, we have the option of using radio frequency on the same catheter. Over the years, it's been really important to us to stay at the forefront of the latest technology, as this allows us to treat our patients more effectively and in a safer manner. Being the highest volume center in South Africa, it gives us the unique opportunity of having early access to the latest technology, in which way our patients benefit from improved efficacy and improved safety of their procedures.